Hello guys, today we will memorize arteries and the veins of the upper limb. As we are familiar with this arch of aorta. This one is internal carotid artery, and this is subclavian artery, which subclavian artery tenders after it crosses the first rib, it becomes the axillary artery. After the axillary artery, which when it crosses the pec it becomes the brachial artery. And brachial artery have many branches. Let's memorize this branch today. Here is brachial artery, and brachial artery gives the first branch, deep brachial or profunda brachii, and it continues till the cubital fossa, and it bifurcates into two. Here it bifurcates into the radial artery, like we can trace here radial artery, and another one is here. This is ulnar artery. Then here is some branch giving rise from the radial artery. Here is recurrent branch radial recurrent branch, and here is ulnar recurrent branch. And ulnar artery gives also another branch which is called the interosseous branch. As we are familiar that between radius and ulnar there is interosseous membrane, it gives the interosseous branch. It's anterior and posterior interosseous, but here we can see only the anterior interosseous. Then further, ulnar and radial artery also gives up the branch. This one is from the radial artery, this one is from the ulnar artery, and forms a palmar arch which is known as deep palmar arch, and further it extends and gives rise to the superficial palmar arches.
Okay,
Let's memorize on the another model. See, this is the left arm, and here we can see brachial artery, and it gives rise to the radial artery. From here we can see little bit of the ulnar artery also, and here we can see the recurrent radial artery. Now, hands, we can consider these two hands. See here, this is the radial artery, this is the ulnar artery, and this is the deep palmar arch, and this is the radial artery and ulnar artery. Here we can see superficial. On this model we can see superficial palmar arch, and here we can see deep palmar arch. Here is the